Hi, I'm back again, Roxy Rose, doing another video, trying to be consistent. As with all my videos, they have to do with transitioning, and in particular, transitioning late in life. Although this video is really applicable for young and old. It has to do, what we're going to do today is inject our weekly injection of estrogen. Now I want to be right up front that I do not condone the do-it-yourself or self-administering these very strong and very potent hormones because there's a lot of adverse side effects that can go badly if unsupervised. I also acknowledge that there are a lot of people out there, because I get these letters all the time, that are self-administering hormones. And although I'm not going to condone this, I will acknowledge that this does happen. And, well, I'm hoping that maybe I could ease a little, give you your nerves a little ease, because I remember trying to work myself up to injecting myself for the first time. And I remember how difficult and how just terrified I was. I mean, not just afraid of the needle, but gosh, I was just so terrified. And the reason why I chose injectable estrogens is because I really had a drinking problem most all my life. I had just assumed, because I never went to the doctor, I had assumed my liver was in bad shape and that I shouldn't be taking these high doses of estrogens, at least orally. And the benefit of an injectable estrogen is that it does not pass through the liver. But there's other methods, creams and transdermal patches that also do not pass through the liver, although their method of delivery is not as effective as injectable estrogens. But then, injectable estrogens have a kind of a more drastic sweep in their delivery. The 2 to 3 days after your injection is when your estrogen is pretty darn high, whereas transdermal patches is a bit more consistent. Same with orally administered hormones. But anyways, I know that a lot of girls out there choose to do the injectables. And there's men out there, or trans men out there, that are doing testosterone via injection. I think that's the only way they can deliver testosterone. And also there's progesterones that can be injected. And I can't remember how those go. But there are. I don't do those, but they are available. What we're going to be injecting is estradiol valerate. Okay, I'm not going to give you the dosage. They come in a package of 10 ampules, which this is an ampule. It's just made out of very thin glass. It does not unscrew, unfortunately. You have to bust the top. I'm going to show you how to bust the top, which funny thing is a lot of people have a lot of trouble busting the top without shattering this thing. Well, I was a glass blower all my life, so handling glass for me is pretty easy, especially, knocking the tip off something like that. So, let's see, make sure you have all your supplies. I have some sterile wipes here, and I have my alcohol, and I have my syringe, and I have my needle, okay? And syringes. The syringe and the needle that I have to start with is a 3 millimeter, that's the volume in which it holds, a 21 gauge, that's the diameter of the needle, and 1.5 inches long. And the needle that I'm going to change for the injection is 25 gauge, and it's 1.5 inches long. Now, the 1.5 inches long is kind of necessary for the injection, because you have to get in there 1.25 inches to 1.5 inches into the muscle, because it is a deep intramuscular injection. So you don't want to be injecting into a fatty area, so that's why there's a certain area that I'm going to show you in a minute. Because if you inject estrogens into a fatty area, there's very little circulation there, and that estrogen is just going to stay there. So we have to get really deep into the muscle. There's circulation there, and then it will be dispersed around your body. So let's see. First of all, let's go ahead and open up the syringe. And sometimes the needles aren't on tight, so just make sure it's kind of screwed on tight enough so that you're not fiddling around there when you have this ampule in your hand. And you're going to take a sterile wipe here. And the first thing you're going to do is we're going to break the top off this ampule. First we're going to clean the top just like that, okay? And then take that sterile wipe and kind of wrap it up like that, okay? And then find yourself a fair corner, you know, it doesn't have to be too sharp but not too dull. And just rest, you're going to rest about, well, you're just going to rest the tip against the corner there, and then just give it a little tap with I'm using just a butter knife. And it does break a little bit, and there's little scraps of glass. Pull off your wipe, and the scraps of glass should come with it, and discard that. So now you have the ampule, and you can see it doesn't really break all that even, but we cleaned it with alcohol, so it is sterile. Now we're going to suck up, and I do this with one hand, and so I grasp it with my 3 fingers, and then with my thumb I have an upward pull on it, as you can see, with the needles all the way down at the bottom of the ampule, and it's sucking up the liquid until you can finally hear it just kind of reach the end of it. So I've got all the estrogen that I need inside this. I'm going to give it a few taps, and then I'm going to push the liquid kind of up to the top. Not all the way, but up to the top. I'm going to, oh gosh, I should get my glasses. I should have had my glasses on to begin with. Okay, now we're going to put the top back on, okay, and open the other needle, and again, this is the 25 gauge. As the numbers increase, the diameters get smaller. That's how gauges work. So this is actually smaller diameter. It's 1.5 inches long, but it's a smaller diameter. You need the 21 gauge diameter because the liquid the estrogen is suspended in peanut oil, which makes it kind of thick. And if we had this on to begin with, we wouldn't be able to suck up the peanut oil and the estrogen. Another concern is if you're allergic to peanut oil or peanuts, this is a consideration because most of the estrogens are suspended in peanut oil. So after we've, let's see, we got our other needle here, and then we're going to unscrew that one, and then we're screwing on the 25 gauge, nice and tight, and just take it off for a moment, and now push up the estrogen all the way until you see a little bit come out the top. Okay, when you see that, and there are no big air bubbles in there, we're going to set this aside. Okay, we got the cap on, we're going to set this aside. And once again, Roxy Rose exposes herself. Okay, so I hope you can see this. How to find the injection spot. Now, you could do it in your derriere, but you're not going to get the privilege of seeing mine today. I prefer to do it in the thigh because I can't see my butt and I'm doing this alone. So that's where we're doing it, in the thigh. So put your hand with your thumb in your crotch area, okay? Groin. And have your hand extended down your thigh, and your ring finger is the start of the injection point. So it's this area here, kind of an elliptical shape here, is where we want to inject, okay? About 5 inches out, about 2 inches diameter across, okay, of an ellipse, okay? Right in that area there, if you could see that clearly. So after we know approximately where our area is going to be, and each time you give yourself an injection, kind of move it a little bit one way or another, because otherwise scar tissue builds up and it starts to get painful after a while. So get yourself another sterile wipe, and we're going to clean the injection site a little bit. Again, your thumb is in your groin area, and then this is the injection site, okay? So I'm just going to clean right there. And we already have our prepared syringe. And so now we're going to do a bit of an injection there. So now there's some people that say go straight in, and there's some people that say hold the skin taut. I had learned from another nurse to go ahead and grab a chunk of that muscle, and it works good for me. I don't know why. And then go ahead and insert the needle. I can't do it fast. I have to go slow. I'm chicken. So anyways, we're going in straight in toward, if you could picture the bone inside the leg, that's where we're headed, in that direction. And so I have an 1.5-inch needle, and only need to go in 1.25 inches, so I have a little room, so I'm not all the way in. And before we inject, it's really important that we have not hit an artery or a vein. So grab hold of the needle and with your thumb again, pull back as if you were pulling up that liquid. And what you want to do is you want to watch down there and see if a little ball or redness appears, which is blood, which means you've hit a vein or an artery, and you don't want to be injecting in that site. Pull the needle out and start over. Discard it and start over. Just start over, okay? So, so I've done that already, and we haven't hit an artery. So now, this actually takes a bit of pressure, and you have to be a little patient. So make sure you have a good firm hold of it. Make sure you're not pushing in or pulling out at the same time. That's a consideration, because it is kind of difficult to do all by yourself. So as I'm pushing in, I'm also releasing at the same time the skin around that area, and kind of giving it or allowing it a little bit room to expand. So, and then you'll see the plunger finally reach the bottom, and then you're done. So again, just slow and a constant pressure. It won't go fast. It's thick liquid, and it doesn't go fast. So I am finished with my injection, and I'm going to pull it straight out, set it aside for 1 moment, get my sterile wipe, and put a little bit pressure on it. And don't forget, cover your needles. I should have my glasses on. Oh gosh. I can't tell you how many times I've stuck myself with a needle because I didn't have my glasses. Then take the needle off, and now you have 2 needles to dispose of, and dispose of your medical byproducts properly. Technically, you're not allowed to put them in the garbage, and technically you're supposed to break those needles. So hold this the wipe on for about 30 seconds, and we're done. It's almost treat time. I hope you've set aside some treats, you know, maybe my cranberry juice, and there's nothing in it. And give yourself a treat, because the child inside you really, you know, has to have a treat if it gets a shot, especially if you have to do it yourself. So that was it. I hope that I have eased a little nerves here, and answered a few questions. If I did anything wrong, I'm really sorry. I get nervous, and the sight of needles, yeah, that's it. So injecting estrogen is not really difficult, but I'll tell you, you don't really get used to it. Now, I've gotten a few emails. People say, where are you? What, is that your house you're at, or are you at some, well, I have a very odd house because I am a very odd person, and equally odd on the outside as I am on the inside, and my house reflects that too. So I guess I don't know how to do videos. I don't know how to stop and start a video and then splice one in. So really, when I do a video, it's like we're going, and if we mess up, sorry, Charlie. So I'm going to go ahead and pull this off the makeshift tripod that I have it on, and then I'll just kind of give you a once around the room here, and then say goodbye. And this is Roxy Rose talking about injecting estrogens. Please don't do it on your own. Please get counseling. Please see a physician. Do this all above board. I know that physicians don't really want to prescribe injectables because then they have to teach you where the injection site is, and then they have to trust that you're going to do it right when you get home. And there's just so much. It's so easier to give somebody a prescription and you say, here, take these pills or these patches. And so often nowadays, especially with insurance the way it is, physicians are trying to really play it safe. So anyways, this is Crazy Roxy Rose, hopefully doing or easing your fears about giving yourself an injection, and maybe answering some questions, and hopefully you will do it right, and take faith in the fact that you are hopefully doing it right. Any questions, just go ahead and email me directly. MyRoxyRose, that's MyRoxyRose@gmail.com. And I will try to answer your questions, although I'm not going to tell you dosages, so hey, don't ask, please. You're putting me on the spot. I feel so bad to have to reject those questions. So I'm going to give you a little tour around the house here. Let's see. This is, let's see, our butler. When we first got him, or when I first got him, he didn't have that grin on his face. But over time, he has quite a grin. And let's see, Rosie over there in the corner, of course. And, yeah, the bear, and then Chief, our Southern California native Indian chief. And, yeah, this is my room. And, yeah, see, the moose was inspired by the bear jamboree at Disneyland. I always loved that. In fact, the outside of my house is somewhat reminiscent of the It's a Small World house. I'll show you a picture of that someday. So this has been Roxy Rose, and hope to see you on another video soon. Bye-bye.